Good afternoon, and welcome to our presentation on new and innovative uses of telehealth. My name is Kathy Wibberly. I am Director of the Mid-Atlantic Telehealth Resource Center and also Director of Research at the University of Virginia Center for Telehealth. And I'll be joined with this presentation with Lloyd Sirmons.
Hey there, good to be with you. My name is Lloyd Sirmons, and I'm the director of the Southeastern Telehealth Resource Center. Kathy and I represent the National Consortium of Telehealth Resource Centers, which is basically 14 total telehealth resource centers. We are funded through HRSA, the Health Resources Services Administration. We are 14 individually funded telehealth resource centers, but we work together. And about 3.5 years ago, we actually formed a consortium for the purpose of working together. We just realized that really, if we pooled our resources together, we were a much better resource and really could serve the people of this country, just in a greater capacity, pooling those resources together. You can see the map here. There's two of the resource centers that are national organizations. The Center for Connected Health Policy deals with policies more at a national level. They do deal also with some tracking state legislation and keeping track of what Medicaid does from a telemedicine reimbursement. And then you have the Telehealth Technology Assessment Center, and they deal with technologies around telehealth and telemedicine. And then you have 12 regional telehealth resource centers, and that's what Kathy and I, we represent today. You can see here on the map in the bottom right, the southeastern portion with the blue states. I cover the states of Alabama, Florida, Georgia, and South Carolina. Kathy, back to you.
All right. So as you'll see from the map that on your screen, I cover the dark purple states, and that starts from the New Jersey, Pennsylvania area from the north all the way down to North Carolina and across to Kentucky. And so what we're going to do today is look at some of the new use cases that have taken place. And I'm going to talk about the use cases. Lloyd's going to talk about the technology behind them. But one of the things that has driven probably all of you to be part of this presentation today is this pandemic. And unless you've been hiding under a rock for the last few months, we know that COVID-19 has really created telehealth and healthcare as one synonymous entity. And so why did it actually take a pandemic to drive this, this sudden culture of innovation, sudden use of technology? Well, I think part of it is because our policy environment has really not supported innovation to date. And so there were many, many barriers to using innovation and innovative technologies. There were reimbursement barriers for sure, but there were also policy restrictions around how we use technology, what kinds of technology we can use. There were licensure restrictions, and then there's the status quo. People are pretty comfortable, doing what they're doing, and there's nothing that drives them to try something different. And so that's part of why it's been slow. As you'll see on this, there's the slow diffusion of innovation as well. Many of you have heard about the 17-year gap between scientific evidence and patient care. And so prior to the pandemic, most of us were in that middle of that hump, so the pragmatists and the conservatives. So the pragmatists are the people who basically have always said, well, why should I start using this technology? What's the point? What I'm doing is working just fine. Why do something different? And the conservatives are the ones who have been skeptical. They're looking back now and go, I should have tried this earlier, but I just want to see what other people do first. I want to see the evidence. I want to see what's going on. There are only a handful of people, if you're thinking about the population, who are really the enthusiasts. I have to try this first. I want to be the innovator. I want to, I'm not happy with the way things are because I know things can be done better. And so what happens is that over the course of time, we evolve into kind of this status quo of the bulk of the people saying, well, yeah, the technology is kind of cool, but, I'll wait to see what happens. And that waiting gets longer and longer. And as we have this pandemic, we are forced to now use technology. And so everyone in that middle of the hump has basically said, well, I have no choice. I have to use it now. And so what we're seeing then are a whole bunch of use cases that because the policy changes have happened as a result of COVID, those policy barriers are no longer an excuse to not using it. And because people are now saying, well, I guess I have no choice because my patients aren't coming in or I don't want to be exposed. And so what's going to happen? So these are a couple of emerging telehealth use cases that are fueled by the pandemic. One is screening and assessment. And we are also seeing this significant need for screening and assessment. But how do we do this and minimize exposure and transmission of the diseases? How do we do this while preserving PPE? Because at the beginning of the pandemic, and it really hasn't changed significantly, though we definitely are not at the crisis level, but we still need to preserve PPE. And then how do we do this without taking a valuable hospital ED or bed space? How do we do this so that people don't have to come into a hospital to get tested or come into a facility to get tested? Tele Rehabilitation is another one, a use case that has really been fueled by COVID-19. Most of telerehabilitation, or almost all of it, was done in person. So everything from PT, OT, speech language. Speech language was ahead of the curve a little bit more than PT and OT. But with the pandemic, we know that people don't want to come into a facility. They don't want to risk exposure. But facilities have been closed. So a lot of PT has been done at a rehab facility or at a school. And so what happens when these facilities are actually closed or only open for small periods of time? And how do we do this for people of all ages? Another huge area that's being fueled by the pandemic is Tele-Autism Care. So we know that the majority of autism care has been done in person. And so we also know that this is a population that is at high risk for COVID and high risk for bad outcomes if they actually get the virus. So again, much of this is happening when facilities and schools are closed. And we have the additional challenge of how do we do this for those who are already having communication challenges, who are already having issues with identifying emotions and connecting with people. And so this is another use case that is being fueled. So telebehavioral health and mental health is an interesting area. It is an area where this has probably been the very first use case for telehealth, in that we've been seeing telebehavioral health for over 25 years now. But it has been a field that's been very averse to innovation in general. We've seen innovation in this space by mostly academics and researchers who are wanting to try something different. But for the overall general population of telemental health providers or behavioral health providers, we've not seen a whole lot of innovation. Yet we are in a space where we have shortage of providers and we need to be able to provide access to care. And it's an area where there's a lot of stigma. So patients, especially rural patients or clients, don't want to show up in a parking lot in a rural area for a behavioral health visit because all their neighbors can see their car in that parking lot and go, oh, they're having a mental health visit. And that stigma keeps a lot of people from participating. And strangely enough, my background is in telebehavioral health. And so when I first started this position, just under 10 years ago now, I actually approached a lot of mental health training programs and I said, why don't you include telehealth technology into your training in telemental health? And the stock answer I got was, we just don't have room for additional course. There's so many accreditation requirements. Unless the students are demanding it right now, we just can't add another elective. And I said, okay, well, that's fine. Well, imagine this. About a year ago, I started getting some requests to teach, a section or a course. 3 months ago, I have now had about 10 requests to teach a section or a course on telemental health. So we're really seeing that pandemic is driving utilization and driving interest. Another area where we're really seeing this pandemic driving things is health professions training and education. So we have almost always done our training and education in person. And now we're trying to do remote supervision. We're trying to do remote residency training. We're trying to do remote internships and practicums. And people are saying, how do we do this? We're teaching hands-on skills. How do we do it remotely? how do we supervise people remotely, and how do we now integrate technology into training if we're not in person? And so a lot of this is driving people's interest not only in the traditional technologies, but in very new and innovative technologies. So Lloyd, take it from here.
Yeah, thank you, Kathy. Good job. So what I'm basically going to do is just talk about some of the technology and how technology has kind of moved or how technology has advanced, and pair some of the technology up with some of the use cases that Kathy was just mentioning. Of course, in today's time, time of COVID, as Kathy mentioned, there's a lot of people who have been really forced into doing telemedicine. And Kathy and I was talking a little bit this morning, and I too have been doing telemedicine for about 10 years. And really, up until about February, I felt like I was begging people for years to do telemedicine. And then all of a sudden, we became, I think Kathy would say the same thing, but we became some of the most popular people, on the block as far as people calling because they were being forced into doing telemedicine and using the technology. So the picture here, of course, is not anything innovative. That's not the purpose, but for any of us who have been in telemedicine for any period of time, we are very familiar with the telemedicine carts and the equipment. When I started back 10 years ago, this is what was being used. And so the telemedicine carts, and as technology does, it advances very rapidly. So what we have seen over the years is a move away from the carts really to more of the laptops, more of the mobile devices, tablets, smartphones, and that's what technology does. So technology moves at a very rapid pace. And Kathy also mentioned, some of the problems that we've seen that telemedicine and the advancement of telemedicine has faced has been really a large part due to legislative and regulatory barriers. And so I think what we've seen over the years is technology just continues to push the envelope, but our legislation and things of that nature, the reimbursement, the policies around telemedicine just hasn't really been able to keep up. And so when you start looking at things like mental health, for example, and you don't need the big carts, you don't need to do all the big technology and the peripheral devices. What you really need to do is to give people access. And so as technology continues to push itself, I think when we start thinking about innovation and you start thinking about new and what's on the market, just as when I started and we were using those telemedicine carts, those big bulky carts, and they were $30-something thousand, and it costs a lot of money to get involved in the telemedicine. Now what we're really beginning to see once again is technology begin to push the envelope. Virtual reality, for example. So when you listen to some of Kathy's use case scenarios and you start thinking about things like rehab, well, rehab of course, is a very hands-on type of service that is typically provided. And I think for the most part, up until about February or March, PT and OT and those things, those type of services, people just were comfortable going to the physician to see the physician, getting their services provided. But really, what has happened over the years is, here again, technology kind of pushes the envelope. So if you think about virtual reality and you think about the headset, what virtual reality does is it really allows the user to be immersed into an environment that's created, that it's computer generated, but it's an environment that can be created to fit the scenario. One study says that by 2030, here you can see that the augmented and virtual reality or mixed reality market will be over $30 billion. Of course, what has happened, in today's, where we are today with the whole pandemic and the public health emergency and COVID, what that does is it limits our physical interaction. So instead of being able to go to the physician's office and receive our services, our physicians have to come up with ways, creative ways of providing services to us virtually. I had physicians who would call and say, look, this is my livelihood. And so now I'm not able to see my patients. I need to be doing telemedicine. And so what happens is in times like this, it causes us to really begin to think outside of the box. And so although this whole virtual reality thing may seem futuristic, for us, the bottom line is it is here and it's actually being used. And I wouldn't even say that it's technology of the future. I would say it's technology of the day. We see it with our of course, in our younger generations. But I think what we have seen over the past few years with technology continuing to advance and technology continuing to immerse itself actually into the healthcare market, virtual reality is just one of those pieces. And it's kind of neat. Kathy mentioned healthcare training and education. One of the videos that I saw online as I was doing some additional research here was a simple video of the proper way for healthcare workers to do hand washing. And so, they would wear the virtual reality, headset, and they would then be immersed into that room, into that environment, and they literally had to spend time washing their hands. If they didn't do a good job or didn't, do it as they were supposed to, they would be, notified by the system. So virtual reality and VR, it's just one of those things that although we may not see it as much today in our everyday world, we are going to continue to see more and more of it. And I would say even, like the study here, by 2030, it's going to be a $30 billion market. And I get that that's a pretty far out projection, but I think it's going to be even more interesting to see where virtual reality plays a role, just say in the next 2 to 3 years. And so another piece of technology I think that is pretty innovative and it's really us, our providers, healthcare providers, thinking outside of the box. Is video games for therapy. Now, this is something I know I had some dealings with the VA out of Gainesville, and the VA actually a few years back where they were already using the Xbox Connect for some of their patients, and their patients would play games. And what happens, and the beauty of this gaming is the ability to be able to get the patients moving and to have them do range of motion. It requires a multitude of cognitive, physical, and social demands that can all be simultaneously improved during a session. So I think this is an area where more people are really tapping into it now because of, most of our children, most of us have Xboxes, or we have PlayStations, or as crazy as it sounds, we have a Wii maybe at the house. So we already have these gaming consoles that are a part of our homes. So now making use of those to be able to provide us these services is just kind of icing on the cake. And so we're starting to see more and more of this in things like autism treatment, rehab, even in some of our mental health stuff. So another piece of another technology I think that we all see, and probably sometimes probably more than what we want to admit, but is AI, artificial intelligence, and then chatbots. And so where this can come in really handy, and I like the scenario that the use case that Kathy gave in talking about screenings on the front end. So things like the time we're facing now with COVID. So AI-powered chatbots can be used to triage patients. They can be used to guide them and then direct them to the appropriate health. They're considered more reliable, more accurate than, say, just me as a patient going on and doing a Google search. They can support clinical teams. by lightening just a daily caseload. After analyzing patient data, bots can suggest an online discussion with a clinician. So in essence, a chatbot or the use of artificial intelligence technology, it promises to ease, as you see here in the slide, the burden on medical professionals. And we're not just seeing this, though, in healthcare. I mean, we're really seeing it, the artificial intelligence, in a lot of areas in our lives. But I think it's just another area where we see the technology kind of immersing itself into the healthcare system. So another kind of new and innovative technology, something that's really happening now, is the smart pills. You can see here, I think it was actually last year that the first smart pill got FDA approval. So of course, that means that there's others that are coming into the market now seeking FDA approval. So I think we're really going to see more and more of this, especially as we start looking at vital sign monitoring and diagnostic imaging, and even with targeted drug delivery. So when you look at, for example, the pills here on the screen, those pills are just equipped with a nano chip. And as you ingest that pill, you have what looks like a bandage, and it reads the information and the data off of that particular chip. I mean, we say, and we may think this is futuristic, but once again, not necessarily futuristic. I mean, this is something that's on the market today, and this is something that's happening today. And Kathy and I were talking about this a little bit earlier, and I didn't put the slides in here, but if you really think about the wearable devices that we have today, when we go out and we buy a watch, for example, most of us nowadays are buying Fitbits, or we're buying Apple watches, or we're buying Garmin watches, or the Samsung watches. We're buying smart watches. So first it was smartphones, and then it was, tablet devices and things of that nature. Now it's smartwatches and all these wearable devices that we can wear, and we wear them for the purpose of monitoring certain health data. And these things continue to push the envelope. For example, the Apple Watch can do an echocardiogram. I mean, it can. And so Apple's, I know the big question has been over the last year or so, is Apple now to be considered a healthcare company? And what we're really seeing is these companies are getting into the healthcare industry. So your Apples, your Googles, Amazon, all these people are getting into the healthcare space. And what it's causing is it's just continuing to cause technology to drive. It's continuing to cause technology to push. And when we're faced with times like we are today with the public health emergency, what happens is it causes us to turn to the technology. Kathy mentioned this earlier. So we had some people, or a lot of people, I guess you should say, who maybe were on the fence and they just weren't sure if they wanted to get into the telemedicine, if they wanted to use the technology, the virtual platforms to see their patients. But what happened is when COVID hit and their practice was shut down and patients were quarantined, then we were forced to use the technology. And so technology is not a bad thing. And I don't want to come off as saying that technology is a fit for everything, or that telemedicine is a fit for everything. There's going to be some services that are always going to be better delivered in person. There's always going to be times where that touch is just going to be the best way, care is delivered. But there's also times where the technology needs to be embraced. And I've always said there's times where we can either go along with the technology and allow technology to shape and use the technology for our benefit, or at some point we will be forced to use the technology. And so, having said that, I don't know, Kathy, if you have any other comments, but I guess we could, take questions.
Yeah, great. Thanks, Lloyd. And I think, the only comment I would make is that we are at a time when we're forced to use technologies, and let's use the things that already exist to our benefit.
That's right.